right, continuing the discussion of helping or pro-social behavior. Previously, I addressed personal characteristics or individual differences among people that can contribute to their likelihood of helping. Now I'm going to talk about contextual or environmental factors that might contribute to someone's likelihood of helping. Now, whenever we talk about this, sort of a classic example or a classic news story almost always gets included in this discussion. And you might have heard of it before if you've taken introductory psychology or another psychology class. It's very common that students have this memory of, oh wait, I think I've heard of this before at some point. It's okay if you haven't. I'll do the refresher, but acknowledging that many people are like, yep, heard about this before. All right, so there was a news story it was 1964. 1964, Kitty Genovese. Kitty Genovese was a murder victim, and the thing about her story that got attention was the way it was presented in the news, and we actually now know that the way it was presented in the newspapers was problematic, not entirely factual, but it got attention, and that's why this case got attention, was they presented it as she was living in a neighborhood with lots of other people, lots of other potential witnesses or potential helpers who could call for help, and she was murdered in broad daylight. She was stabbed multiple times, and she was making noise. She was screaming. And the way the news reported it, they said that there were 37 people who heard her screaming, but nobody called for help. And that was what was shocking about the story. People are like, why didn't anybody help? Why didn't these people help that poor woman? And various ideas were put forward about why that wouldn't happen. And so again, I do want to acknowledge that we now know that the number 37 is problematic. We actually, going back to original records, we don't even find any example that the 37 count was accurate. And there's evidence that some people did try to call for help. It wasn't just that you had 37 people that did absolutely nothing. All right. So this is more about how it was presented and how it got attention than what actually happened in this particular case, this particular crime story. And so we find this situation that we do see that the more people are around when you need help, the more people that are around, the less likely it is that you will get help. And so we have to explain that. Why? Why in the world would having more potential helpers around mean that you're less likely to actually get help? And one idea that was proposed is the urban overload hypothesis, specific to people living in big crowded areas like cities. The urban overload hypothesis, it argues that people in cities, in heavily populated areas, they avoid social interactions with strangers simply because they are overwhelmed by the number of strangers that are around them. It's too many people, it's too much potential interaction, and so you kind of shut down and avoid interaction. So they're overwhelmed by the number of people they encounter each day. It's like too much for the human brain is the idea that's inherent there. All right, so that was one idea. It was something about the fact that she was in a city. Like this wouldn't happen for people who weren't living in these heavily populated, heavily crowded areas. There was one study that showed that about half of the people in small towns helped someone in pain compared to only 15% in large cities. Okay, so that's a little bit of evidence saying, hey, maybe there's something to this. And an important concept that has to be brought up here is something that is, it's often covered elsewhere in a social psychology class, and that is diffusion of responsibility. And this is something that often happens in groups. When you are working in a group, at my university, we have a separate class called Group Dynamics, where this is would definitely be covered. I actually did not cover the chapter where this comes up because there's this separate class about group dynamics that many students take, and they complain that there's too much overlap. All right, but so for those who don't know, for those who haven't had the group dynamics class, what is diffusion of responsibility? Diffusion is like spreading or dilution. When you have a bunch of people, responsibility gets spread out. It gets diffused. So if you're just by yourself, you have all the responsibility for getting something done. Think of school projects. When it's an individual project, an individual paper or report or presentation, and you're the only one doing it, you know that you have to get the work done. But if you have a group project, you're like, well, hey, we've got 7 members of our group. We have 1/7 of the responsibility, or sometimes even less, where you engage in another thing called social loafing and you just hope to get as little as possible. All right, but the idea is that you have less responsibility. When you're in a group, everybody has a little bit of responsibility instead of having all the responsibility like they would have if they were by themselves. And so this diffusion of responsibility. The diffusion of responsibility occurs when each person in a group feels less accountable, less responsible, less accountable to take action because the other people can do something. It's not all up to me. There are other people that can help. Don't guilt me, because why aren't they helping, right? So that's one thing that can be at play here, is this diffusion of responsibility. Now, this leads us to a different concept that was proposed called the bystander effect. Now, with the bystander effect, this refers to that phenomenon, that trend, where the likelihood of helping in an emergency where someone clearly needs help, it's a crisis. It's the sort of thing that you wouldn't think would be optional. You know, this is like somebody saying, help, I'm dying, that sort of situation. Somebody in a burning building, something where not helping isn't just rude, it would be disastrous. And so the likelihood of helping in an emergency, it decreases. It goes down as the number of people who witness the emergency increase. So the bystander effect has to do with this negative or inverse correlation. As one goes up, the other goes down. As the number of potential helpers go up, the actual likelihood of being helped in an emergency or crisis goes down. All right, so what do we do with that information? Big names in this area studying the bystander effect, and they were inspired by the Kitty Genovese story, are Latane and Darley. And they have done they did a lot of research looking at diffusion of responsibility and the bystander effect. They manipulated a lot of variables, doing actual experiments in a laboratory setting and in a field setting. And one of the classic studies that they conducted was they had participants show up they volunteered for a study, a psychology experiment of some sort, and they met with like a secretary or some kind of a clerical staff worker, and they said, oh, here, go in this room over here and fill out this paperwork. And so they were taken to a room to fill out their paperwork. Now, they were randomly assigned to two different groups. One group, they went to the room by themselves. So here, you by yourself, alone, go to this room and fill out the paperwork. Other people were taken to the room in groups of 3. So you 3 go to this room and fill out your paperwork. And then they all experienced the same thing of smoke coming through the vent into the room. Now, people, if smoke starts coming into the room, what should your reaction be? All right? Most people are like, well, of course, if smoke's coming into a room, you think there might be a fire, you want to get out of there. At the very least, you need to go and report that and say, hey, you know there's smoke coming into the room. Is that normal, or should we be concerned? And guess what they found? People who were by themselves, they went and they stood up and said, whoa, 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 there is smoke coming into the room. The people who were in groups of 3, they just sat there. Or not always, but they were much more likely to just sit there and look around and be like, they don't look alarmed. It's cool. Nobody else is getting up. All right, well, if it was a real emergency, somebody would get up. They were significantly less likely to get up, leave the room, report the emergency or potential emergency if they were in a group rather than by themselves. So maybe they'd burn to death because of this bystander effect or diffusion of responsibility. They also had another one of their experiments involved people were on a phone line, a group phone. You had multiple people on the same call, and one person faked having a seizure. And so they wanted to see if people would try to intervene, would try to report like, hey, somebody's in crisis here, and they found the same thing. If you were by yourself, you would get alarmed and you try to intervene. In a group, you'd assume everything was fine because other people weren't reacting. They also went out into the field. A field study or a field experiment is what we call it when you actually do your observations in the real world. You still have a manipulated variable of some sort, but you're not in the controlled setting of a laboratory. You're in a real world natural setting. And they did things like having people on an actual city sidewalk pretend like they were in crisis, like pretend like they were having, acting like they were potentially having a medical crisis to see if people would intervene. And they found if you were walking down the sidewalk by yourself and you saw this person, you would stop and try to help. If it was a big crowd walking down the sidewalk, you'd be like, well, nobody else is stopping. I guess everything is fine. And so, you know, those are just some of the different versions of this type of experiment that were conducted by Latane and Darley. Latane and Darley. Let's see. Other bits of evidence that we have, not just from those two researchers. Other evidence, managers are more likely to report fraud when they alone have the information. If it's discovered by multiple people, you're less likely to report it. You're assuming, well, they'll report it. Somebody will report it. It doesn't have to be me. We also see for cyberbullying. Now, I cover this in my developmental psychology class. I'm thinking many of you probably know what cyberbullying is, but if you need the definition, that is when you bully using electronic means. So, you know, sending text messages, direct messages, creating a mean rumor spreading website or something. So, you know, electronic based bullying. We see that intervening in cyberbullying, report it, trying to stop it, trying to get it shut down, there's a negative correlation between intervening and the number of witnesses, the number of people who see and know about the cyberbullying. If it's something where just like one or two people know that this is happening, they're much more likely to try to help, to try to report, to try to get that shut down. If it's a bunch of people, they're like, well, somebody's going to report this, right? So, and then video game, multiplayer video game. We know what that is, right? All right, so your multiplayer video game, we actually see that in situations where there is not cool behavior, harassing type of behavior in video games, we actually see that whether it's a multiplayer versus a single player game, you see differences in helping behavior. All right, and when I say single player, I mean someone else is seeing the single player. I don't know if any of you have had experiences with online interactions and online gaming. There's sort of interesting research about what contributes to people acting horribly on the internet. We've talked previously, the anonymous nature of things does contribute. The fact that you can act horribly and people don't necessarily connect it to your actual name, your actual job, your actual school, and things like that, that contributes. But people can act horrible on the internet. I'm sure you've heard or possibly had your own experiences. Okay, other things about helping and situational factors that can contribute to your likelihood of helping. We are more likely to help people we like, right? So if it's like your friend or someone you just have positive attitudes towards. People who are similar to you. So this could be a situation where if someone seems to be different than you in race or class or any other obvious cue to lack of similarity, you're more likely to help people who seem to need help, who seem similar to you. And we also are more likely to help people who we perceive to be in our in-group, using previous terminology. Similar clothing to yours. You're more likely to provide money to someone who says that they need money if they are wearing similar clothing. And also teams. If you are visibly displaying which team you root for, you're more likely to help somebody who is visibly displaying being a fan of your team. Right, so there's some other factors here, and this is I say that these are, environmental or contextual factors, but they're overlapping with personal factors too, interacting and overlapping with personal factors. All right, so this leads up to Latane and Darley I keep saying Darley, Latane and Darley, they proposed 5 steps, a 5-step model for helping. These things have to happen for helping to occur. All right, step 1. People must notice the event. One issue with helping is sometimes you generally don't see the person fall down or the person get attacked, or you don't realize that a room is on fire or something. You have to detect with your 5 senses that there is indeed some kind of a crisis. There is need for help. So they have to notice the event. Number 1, they have to notice the event. Number 2, they have to interpret it as an emergency. Sometimes you might see somebody walking down the streets in a way that they're kind of wobbly. You might interpret that as they're drunk rather than, oh, they're about to have a heart attack or other medical or health crisis. If someone may have just been attacked, and you might think, they're goofing around, like they might look like they're falling from an attack, and you might think, oh, they're goofing around, and you might realize, no, somebody just hit that person. That's why they're falling backwards. So you have to accurately interpret it as an emergency. That's important too. Number 3, now here's where how many people around can really be relevant. You have to take the personal responsibility. All right, so number 3, you have to actually say, it's my duty to help. I am responsible for helping. And not everybody's going to do that. You can easily assume that somebody else is going to take care of it. Number 4, you have to know how to help. Sometimes you know that helping is needed, but you have no idea what to do. Someone may be having a medical emergency, and you may have no idea how to help them other than calling, like you might call an ambulance, call 911. But in the moment looking at them, you're like, well, does this person need CPR? I don't have the medical training to know what this person needs right now. They clearly need help, but I don't know what it is. And then 5, you have to then implement the decision to help. You actually have to go through with your intention to help, and sometimes for a variety of reasons, people don't do that. All right, so all of those 5 things have to happen for helping to happen, and sometimes it happens, sometimes it doesn't. All right, this is going to end the video series on pro-social behavior and helping. All right, as usual, I like to give my little explanation that there are more that I could have gone over. This is just the basic stuff for a class that's an introduction to social psychology. For upper level and graduate classes, more detail may be relevant.